Breathe light to breathe right. For thousands of years, masters of the ancient arts of yoga, tai chi, and qigong have espoused the importance of quiet, gentle, and light breathing. I recently had the pleasure of meeting Tai Chi master Jennifer Lee in London. Master Lee has reached the rank of 7th Dan and was awarded gold in 10 categories during the International 2009 Wushu Championships held in Hong Kong and Hainan, China. As the two of us talked, Master Lee described the similarities between her work and mine. She explained that during Tai Chi tournaments, judges pay particular attention to whether they can notice the breathing of competitors, with points being deducted when breathing is evident. Without knowing why, other than the fact that it has been passed down from generation to generation, Master Lee practices a breathing exercise that is very similar to the reduced breathing exercise we will explore further on. It is no coincidence that Master Lee's breathing was textbook perfect. It was abdominal, effortless, and almost invisible to the eye. I have watched many people breathe, thousands in fact, and without doubt, Master Lee displayed the most perfect breathing I have ever seen. Well-known Qigong and Tai Chi master Chris Pei explains how breathing is at the very core of the Chinese concept of Qi.
Generally speaking, there are three levels of breathing. The first one is to breathe softly, so that a person standing next to you does not hear you breathing. The second level is to breathe softly so that you do not hear yourself breathing. And the third level is to breathe softly so that you do not feel yourself breathing.
This philosophy of effortless breathing is echoed by authentic teachers of Indian yoga and traditional Chinese medicine. I use the word authentic in order to differentiate practitioners who have a deep knowledge of breathing and how it affects physiology from those who don't. Unlike many modern Western teachers of yoga who instruct students to breathe hard in order to remove toxins from the body, authentic teachers know that when it comes to breathing, less is more. The traditional Chinese philosophy of Taoism succinctly describes ideal breathing as so smooth that the fine hairs within the nostrils remain motionless. True health and inner peace occurs when breathing is quiet, effortless, soft, through the nose, abdominal, rhythmic, and gently paused on the exhale. This is how the human beings naturally breathed until modern life changed everything. The comedian Lavelle Crawford, who is admittedly quite a large man, got a laugh from his audience while telling the story of a young boy who stopped him in the street to ask, "You're so big, how many stomachs do you have?" This inquiry was quickly followed by, "Why are you breathing so hard? You got asthma or something?" While the kid's manners left something to be desired, a fact that Crawford observed in his act, he got it right when he recognized the problematic nature of noticeable breathing. The commonly used practice of taking his big breaths is based on the misconception that taking in more air will increase the oxygen levels of the blood. However, since arterial blood is already almost fully saturated with oxygen between 95% and 99% during normal healthy breathing, big undercourse breathing is rendered totally unnecessary. Authentic teachers are not adding anything new. Instead, they are helping to counteract the negative effects imposed on breathing by processed foods, stress, excessive talking, stuffy air, and the false belief of the benefits of taking big breaths. Authentic professional yoga practitioners will have developed a high tolerance to carbon dioxide through their practice, sometimes to the point of being able to sustain one calm breath per minute for a whole hour. This impressive breathing efficiency implies quiet, gentle breathing and a high, bold score. This is exactly the goal of the Oxygen Advantage program, to bring your breathing back to basics and to incorporate the wisdom and time tested principles of ancient man that are enshrined by authentic teachers. What is a deep breath? Unveiling the myth. Sometimes the same word can conjure up different meanings for different people. Take the word deep as an example. Deep, undercourse, can be defined as a measurement that extends far from the top. But this explanation is not always clear cut. The bottom of the deep end of a swimming pool is obviously farther from the surface of the water than the bottom of the shallow end. But when the word deep is used in context of taking a deep breath, it can be open to many different interpretations. Such an instruction is commonly given by stress counselors, yoga practitioners, and sports coaches, resulting in the student taking a big breath of fresh air into the lungs, but often this is done through an open mouth while activating the upper chest. Such breathing is both big and shallow, not deep. This type of breathing is entirely the wrong thing to do if your objective is to deliver more oxygen throughout the body. If you use the definition of extending far from the top undercoats in the context of deep breathing, the top will refer to the top of the lungs or the upper chest. A deep breath, therefore, means to breathe down into the full depth of the lungs. It also means using the main breathing muscle, the diaphragm, which separates the chest from the abdomen. During rest, healthy animals and babies naturally take deep, silent breaths. With each inhalation and exhalation, the abdomen gently expands and contracts. There is no effort involved. The breath is silent, regular, and more important, through the nose. If you want to learn what constitutes good breathing, observe the breathing of a baby or a healthy pet whose breathing has not been altered by the effects of modern lifestyles. The Bell's jar diagram above illustrates the relationship between the movement of the diaphragm and the movement of the abdomen. As you breathe, your abdomen moves in the opposite direction. The reason why the abdomen moves outward with the in breath is because the diaphragm pushes downward, exerting gentle force on the abdomen. As you exhale, the diaphragm moves upward, taking pressure off the abdomen and moving the abdomen inward. To bring air down into the depths of the lungs, it is not actually necessary to take a big breath, as even the quietest of breaths will activate the diaphragm. When you are practicing abdominal nasal breathing, you should not be able to see or hear your breath during rest. In contrast, over breathing through the mouth in an attempt to take a deep undercourse breath will be clearly audible and cause the chest to rise and fall, but will not still manage to draw the breath deeply into the lungs. The diaphragm. The diaphragm is a dome-shaped sheet of muscle that separates the thorax, which houses the heart and lungs, from the abdomen, which houses the intestines, stomach, liver, and kidneys. The diaphragm serves as our main breathing muscle, and if used correctly, it provides deep and efficient breathing. Poor breathing habits do not take full advantage of the diaphragm and instead encourage the inefficient overbreathing from the upper chest. To determine where your diaphragm is located, place your hand just at the base of your ribcage. Move your ribcage from the front of your body to the sides. A good rule of thumb is that the diaphragm is located about 4 buttons down on your shirt. Abdominal breathing is more efficient because of the shape of the lungs. Since they are narrow at the top and wider at the bottom, the amount of blood flow in the lower lobes of the lungs is greater than in the upper lobes. The faster upper chest breathing of people who chronically hyperventilate does not take advantage of the lower parts of the lungs, limiting the amount of oxygen that can be transferred to the blood and resulting in a greater loss of carbon dioxide. Not only this, but the upper chest breathing activates the fight or flight response, which raises stress levels and produces even heavier breathing. Observe your own breathing when you are stressed, or watch the breathing of anxious relatives, friends, and colleagues. You will see that this type of breathing is generally located in the upper chest and goes at a rate that is faster than normal. When we are stressed, we tend to overbreathe and resort to breathing through the mouth. Stress breathing is faster than normal, audible, produces visible movements, and often involves sighs. Many people habitually breathe in this manner every minute of every hour of every day, holding them in a perpetual state of fight or flight with adrenaline levels high. The work of even the best counselors, psychologists, and psychotherapists will be limited unless they first help their patient to address their dysfunctional breathing. When oxygen delivery to the brain is reduced, no amount of talking and reasoning is going to correct this deficiency. Stressed and anxious patients can only make the progress they really need when their bad breathing habits are addressed. On the other hand, healthy individuals who are relaxed and relatively free from stress will exhibit breathing that is abdominal, slow, gentle, calm, regular, relatively unnoticeable, silent, and through the nose. To achieve this type of breathing and reduce the negative effects of stressed overbreathing, it is important to activate the body's parasympathetic nervous systems to elicit the relaxation response. To do this, you will need to adjust your breathing habits in order to properly use your diaphragm. Avoid sighing, panting, and breathing through the mouth, and become accustomed to slow, gentle, relaxed, calm, and quiet breathing through the nose. This is how we should breathe during rest every minute of every hour of every day. Within a very short time, you'll find that you feel calmer and more energetic and are able to sleep better. The positive effects of abdominal breathing will continue to transform every aspect of your health, including your sports performance. Another advantage of abdominal breathing is that it assists with lymphatic drainage. The lymphatic system is effectively the body's sewerage system, draining away waste materials and excess fluid. As the lymphatic system does not have a heart to pump the waste throughout the body, it is reliant on the motions of the muscles, including the diaphragm. During abdominal breathing, lymph is sucked through the bloodstream, neutralizing and destroying dead cells, reducing fluid retention, and improving detoxification of the body. By utilizing the natural benefits of abdominal breathing, you will improve the quality of your blood flow, increase delivery of oxygen to working muscles, and reduce the symptoms of anxiety associated with overbreathing. Returning your breathing habits to the natural and efficient methods you were born with will also allow you to enjoy better health and maximize the potential of your sports or exercise performance. Use the following exercise to encourage abdominal breathing during rest and sports until it again becomes second nature. As the objective of the Oxygen Advantage program is to restore light abdominal breathing with a high BOLT score, the exercise below forms the foundation upon which remaining exercises are practiced. Breathe light to breathe right. During the process of breathing, oxygen is drawn into the lungs and excess carbon dioxide is exhaled. The respiratory center located in the brain continuously monitors blood pH, carbon dioxide, and to a lesser extent, oxygen. When the level of carbon dioxide in the blood increases above programmed levels, the respiratory center transmits impulses that tell the respiratory muscles to breathe in order to remove the excess gas. When we breathe too much over the period of hours to days, as in the case of chronic stress, the respiratory center adjusts to a lower tolerance of carbon dioxide. Having a lower than normal tolerance to carbon dioxide results in the respiratory center increasing the rate of impulse to the respiratory muscles. The result is habitual overbreathing and excess breathlessness during physical exercise. You are practicing this exercise correctly when you slow down and reduce your breathing sufficiently to create a tolerable need for air. The need for air signifies an accumulation of arterial carbon dioxide, the goal of which is to reset the respiratory center's tolerance to this gas. To assist with this, it is very helpful to exert gentle pressure against your chest and abdomen with your hands. Try to maintain the need for air for the duration of 4 to 5 minutes. To practice this exercise, it can be very helpful to sit in front of a mirror to observe and follow your breathing movements. First, sit up straight. Allow your shoulders to relax. Imagine a piece of string gently holding you up from the top of the back of your head. At the same time, feel the space between your ribs gradually widening. Then, place one hand on your chest and one hand just above the navel. Feel your abdomen gently moving outward as you inhale and gently moving inward as you exhale. Then, as you breathe, exert gentle pressure with your hands against your abdomen and chest. This should create resistance to your breathing. Breathe against your hands, concentrating on making the size of each breath smaller. With each breath, take in less air than you'd like to. Make the in-breath smaller or shorter. Gently slow down and reduce your breathing movements until you feel a tolerable hunger for air. Breathe out with a relaxed relaxation. Allow the natural elasticity of your lungs and diaphragm to play their role in its exhalation. Imagine a balloon slowly and gently deflating of its own accord. And then, when the in breath becomes smaller and out breath is relaxed, visible breathing movements will be reduced. You may be able to notice this in a mirror. By using a simple exercise like this, you may reduce your breathing movements by 20 to 30%. If your stomach muscles start to contract or jerk or feel tense, or if your breathing rhythm becomes disrupted or out of control, then the air shortage is too intense. In this situation, abandon the exercise for 15 seconds or so and return to it when the air shortage has disappeared. At first, you may only be able to maintain an air shortage of 20 seconds before the urge to breathe is too strong. With practice, you'll be able to maintain an air shortage for longer periods. Remember, you are trying to create an air shortage that is tolerable but not stressful. Aim to maintain this tolerable air hunger on the course for 3 to 5 minutes at a time. Practicing 2 sets of 5-minute exercises is enough to help you reset your breathing center and improve your body's tolerance for carbon dioxide. When you practice breathing light, the accumulation of carbon dioxide in the blood will result in certain physiological changes in the body. These include a feeling of increased warmth resulting from the dilation of blood vessels, a rosy red color coming into the face, increased production of watery saliva in the mouth, which is an indication that your body is going into relaxation mode and activating parasympathetic nervous system. All of these changes are normal and should not cause discomfort. However, if you experience dizziness or anxiety while practicing an oxygen advantage exercise, then it is better to refrain from doing this exercise and contact an oxygen advantage practitioner who can establish that you are doing the exercise correctly. Timing your breathing, a fundamental error. You may have noticed that while we attempt to reset breathing volume toward normal, there is no suggestion of changing the number of breaths per minute or to time the length of each breath. This is deliberate. Using time to measure the size of a breath is a fundamental error. Modern Western society seeks to quantify everything in terms of measurement, including our breathing, but when it comes to retraining poor breathing habits, it is not the timing that needs to be focused on. Altering the number of breaths per minute or counting the size of each breath in seconds has taken root in many breathing techniques, but actually has little or no effect in addressing poor breathing habits. For example, telling someone to inhale for 2 seconds and exhale for 3 seconds does not provide guidance on whether they should take in a very gentle breath or a huge inhalation. The volume of a gentle breath would be far less than the volume of a large breath. And since we are concerned mainly with volume and reducing it toward normal, counting the length of a breath using seconds does not work. The following illustration shows two different breaths, each with an inhalation length of 2 seconds and exhalation of 3 seconds. Note the difference in the amount of air taken into the lungs by each breath, despite them being the same length. Similarly, it is not possible to address poor breathing habits by changing the number of breaths per minute. Take, for example, an individual who breathes 20 breaths per minute, with each breath consisting of 500 ml of air. The breathing pattern provides a total volume of 10 liters per minute, and since 10 liters of air per minute is too much, the individual may be mistakenly instructed to remedy this by reducing the number of breaths per minute from 20 to 10. However, changing the number of breaths in this way will simply result in each breath doubling in size to compensate for the reduction of the breathing rate. There will be no change to breathing volume, and the individual's symptoms will persist. There is only one way to change your breathing volume and rate, and that is by slowing down and diminishing the size of each breath in order to create a shortage of air. In time, as breathing volume changes toward normal, you will obtain a higher Bolt measurement, and the number of breaths you take per minute will automatically reduce. To reiterate, it is impossible to change breathing volume by altering breathing rate, but the best way to naturally alter your breathing rate is to reduce your breathing volume. As your bolt increases, not only will the size of each breath decrease, but so too will the number of breaths taken per minute. Learning and applying the above exercise to your daily breathing will provide an excellent foundation on which to build a more efficient breathing technique during sports. Just as if you are building the house of your dreams, the most crucial aspect is the foundation. There is no point building a beautiful structure on top of a weak foundation. To do so would be futile, as the building would topple soon after it was built. The same rule applies with addressing your breathing volume. Breathing light to breathing right is the foundation on top of which we simulate high altitude training during many sports activities, as you will see in the following chapters. Take your time to become familiar with the techniques of abdominal breathing and reduced breathing before you move on.